You're listening to the Life with Old Dogs podcast, and I'm your host, Dawn Mimnaugh, primary caretaker of all of our wonderful senior German Shepherds right here at Woody's Place Senior German Shepherd Sanctuary. This week, we are covering pancreatitis in senior German Shepherds. We are just about finished the 20 most common health issues in senior German Shepherds. That was season 3. I think we have about 3 more after this, and then we're going to be done. And anyone who has subscribed to join our Life with Old Dogs tribe is going to get a free PDF book that covers the entire season. Okay, that's all 20 common health issues in senior German Shepherds. So if you want to be a part of that, you can go to our website, wpsgss.org, scroll about maybe not even halfway down the page, and on the left-hand side, you'll see a postcard to join our Life with Old Dogs tribe. All you have to do is enter your email address, and you will get that free PDF book to keep for your own personal reference. And just so you know, when we get your email address, we don't give your information to anyone. We don't sell it to anyone. We don't inundate your email box with a whole bunch of junk. Basically, it's a newsletter that's gonna go out full of good stuff. Tells you what's happening here at the sanctuary. It may include some recipes. Talk about other issues such as degenerative myelopathy a little more in depth, and products that we use, and also what's going on in the Shepherd Shop. That's the online store that supports the sanctuary. So there you go. That's it. All right, so let's get to it. Pancreatitis in senior German Shepherds. Now, as a senior German Shepherd parent, and I just want to clarify, senior being 8 years and older, okay, but this pancreatitis can pertain to any age and any breed of dog for that matter. But German Shepherds are a little more prone to issues with the pancreas than particular other breeds. So here we go. As a senior German Shepherd parent, you may be concerned about your fur friend's health and well-being, and why not? You love them. You've loved them their whole lives, and now they're coming into their golden years. That's when health issues start to creep up, and you want to make sure you get ahead of it before it gets bad. So one condition you may not be familiar with is pancreatitis. The pancreas, for those of you who may not know, is a small organ that sits behind the stomach and intestines. The purpose of the pancreas is to digest food. It's to help aid in digesting food while also regulating blood sugar levels through the production of insulin, which helps move glucose from the bloodstream into the cells so that it can be used for energy. So, tiny little organ, but it clearly has a big job. All right, so that's what the pancreas is. Now, what is pancreatitis? So pancreatitis it's a serious inflammation of the pancreas that can be fatal if left untreated. It is no joke, okay? It needs to be addressed, and it needs to be addressed right away if you suspect your senior German Shepherd has pancreatitis. So early diagnosis and proper treatment helps many senior German Shepherds make a full recovery from this potentially life-threatening condition. Okay, and I'm emphasizing on the early treatment part. Don't guess, okay? If you suspect it, like with many of the other top 20 health issues, some are a little more gradual, others are urgent, okay? And pancreatitis is a more of an urgent matter and you want to get it addressed right away. What causes pancreatitis? The exact cause of pancreatitis is it can be difficult to nail down because the symptoms look like other illnesses. So that can be a bit of a challenge in and of itself. But there are a few factors into what causes pancreatitis. Some of those can be an infection, such as Babesia. I hope I'm saying that right. It is Babesia, Babesia, and that is a tick-borne infection. Another is Leishmania. I hope I'm saying that correctly. That is Leishmania, Leishmania, and that is a parasite. So those two things, Babesia and Leishmania, can contribute to pancreatitis. An injury could contribute to pancreatitis. Even some drugs, like certain antibiotics and chemotherapy, can cause pancreatitis. But the most common denominators in pancreatitis are our fur friends ingesting fatty foods. Think of like bacon grease, too much bacon grease, or something like maybe too much ham, something like that, which, really you shouldn't be giving your dog anyway, but that can certainly contribute to it. And also dogs who scavenge through trash are more prone to getting pancreatitis. Obviously, there's things in there that they shouldn't be eating, and that could inflame the pancreatitis as well. And last but certainly not least, pancreatitis can be idiopathic. I mean, they just don't know sometimes why the pancreas is inflamed. So there are two types of pancreatitis. It's kind of like kidney disease. There's acute and chronic pancreatitis. Acute pancreatitis comes on suddenly, and we've had this here at the sanctuary, acute pancreatitis. Whereas chronic it's more long-term and the symptoms aren't quite as pronounced as acute pancreatitis, which acute pancreatitis, the symptoms are like just bam, right in your face. Chronic pancreatitis is not as common as acute pancreatitis. So the symptoms of, let's start with acute. The symptoms of acute pancreatitis are persistent vomiting, diarrhea, loss of appetite, dehydration, serious lethargy, and abdominal pain. And chronic pancreatitis, it's similar. The symptoms are similar. They're just not as pronounced. They're just not as in your face. They may be a little bit more subtle than that. Not a whole lot, but a little bit more. We had Dark a couple years back. He passed away from bloat, but we had Dark, and Dark had pancreatitis twice while he was in our care, and he really wasn't with us terribly long. I want to say like maybe 15, 16 months, somewhere around there, and he had pancreatitis twice, and I really couldn't figure out what caused it. I'm pretty on top of the dogs here at the sanctuary. They don't get into trash. There's no scavenging or anything like that. I don't feed them ham or anything really fatty. So I don't know what was going on with him. I believe it was, idiopathic, because we couldn't figure it out. All we could do was treat the symptoms when the bouts came about, and he had it twice. So when he had it, all we could do was treat the symptoms for the pancreatitis. Hey there, folks. This week's episode is being sponsored by The Shepherd Shop. The Shepherd Shop sells German Shepherd and dog-related merchandise, as well as our one-of-a-kind Woody's Place merchandise, with proceeds supporting Woody's Place Senior German Shepherd Sanctuary. So to check out the Shepherd Shop and support the sanctuary, head on over to www.wpsgss.org/Shepherd Shop. That's SHEPHERDSHOPPE. And now, back to our episode. Your senior German Shepherd has been throwing up, diarrhea, not eating, just not looking well, whining, probably because, his abdomen is causing him great pain, and you're concerned. So you don't wait long to take him to your trusted veterinarian to find out what the heck is going on. So how is pancreatitis diagnosed? Well, unfortunately, it can be difficult to identify because the symptoms of pancreatitis they're not specific and they are similar to other illnesses. So she most likely is going to do a physical examination, definitely check out the abdomen, see if there's any, sensitivity. And she's also most likely going to run blood tests to help identify any other particular illness. It's not going to help with pancreatitis, but it may help rule out other illnesses. It will help rule out other illnesses, a general blood test. That being said, there is a specific pancreatitis blood test that's called pancreatic lipase, LIPASE, to help make a better diagnosis of pancreatitis, but even that is not 100% foolproof, but it is better than a routine blood test. Other methods she may use to help make a diagnosis is to order an X-ray to rule out the possibility of an obstruction. So here's the thing. If your senior German Shepherd loves to play with toys, let's say he swallowed a squeaky, and it's causing an obstruction in his intestine, the symptoms of pancreatitis can be similar to that. Likewise, if he likes to chew on rope toys and he keeps chewing little fibers of rope and it, gets tangled in his intestines, that will cause a blockage as well and cause similar symptoms of pancreatitis. So the X-ray will rule out if he has an obstruction. And finally, she will order an ultrasound to view the pancreas for abnormalities. So with all that being said, we have had one dog here at the sanctuary, one resident that was dark. He wasn't with us for very long, maybe like a year and a half, and he had pancreatitis twice while he was here, and really couldn't determine why. So pancreatitis, like I said, it can be idiopathic as well. Never was really able to determine what it was, but he did have 2 bouts of acute pancreatitis. And again, we were never able to determine what was causing it. All we could do was treat the symptoms as they were present and until they went away. So let's talk about treatment for pancreatitis. So the first thing your trusted vet is going to do is she's going to try to determine what caused the illness in the first place and address it. If you can figure out why your senior German Shepherd had pancreatitis, let's just say it was Easter. Easter and Thanksgiving, folks, that big times for pancreatitis in dogs. I think Thanksgiving is the biggest time of the year for pancreatitis in dogs. So let's just say that. Let's just go with Thanksgiving. And you're having the big Thanksgiving spread, and you've got everything. The turkey, the gravy, the mashed potatoes, macaroni and cheese, green bean casserole. You got all that stuff. And it's fatty. It's really fatty food, and you want to give your senior German Shepherd a plate because it's a special occasion and you want him to celebrate too. You don't know how many more Thanksgivings he has left. So let's give him that. And then all of a sudden he ends up with pancreatitis because here he just ingested a large amount of fat and, his pancreas can't handle it. So your vet will talk with you about that and say, listen, it's not a good idea to give your senior German Shepherd a plate of Thanksgiving food that's a feast for a grown man. That's just not going to happen. He can have some Give them some of the turkey breast, but make sure the skin is removed because too much skin can lead to turkey skin can lead to pancreatitis as well. So she'll address issues like that. If he's a trash picker, she'll talk with you about that and say, you got to keep him out of the trash. Get a special trash can. Keep it in a pantry so he can't get in there. Things like that. She may also, like I said, if there's some sort of tick-borne illness, she'll address that. If he's on an antibiotic that's affecting his pancreas, she'll take him off of it and put him on something else. So that's the first course of action, is to try to identify what caused the pancreatitis and address that first and eliminate those concerns so it doesn't happen again. Other than that, the only course of action that can really be offered is supportive care, whether it be acute or chronic. Supportive care is all that you can really do for pancreatitis. So the first thing that will happen is to withhold food for 24 hours to let the pancreas start to heal. And that's really important. And dogs can go 24 hours without eating. I mean, people can, and dogs can too. So 24 hours without eating. After that, it will be a bland diet for a few days, such as ground turkey with brown rice, maybe a little bit of pumpkin in there, or something along those lines, ground chicken with a little bit of rice, but something bland for the next few days. Pain relief for any abdominal discomfort will be given, as well as anti-inflammatory medication to reduce the inflammation of the pancreas, and also anti-nausea medication. So we use Serenia. We really like that. It helps with stopping diarrhea and vomiting. So that's our go-to is Serenia. Now, at this point, I just feel like I need to say, of course, I know that there are those people who like to use natural alternatives first to help with anti-nausea, pain relief, and stuff like that. But pancreatitis is a serious illness. And when it comes to something like this, I would rather know that he's getting better, he's getting the care that he needs, instead of wonder, is my natural herbal remedy doing the trick or not? I want something scientifically proven to show that this medication that I'm giving is helping this senior German Shepherd with pancreatitis, because I don't want him to suffer. So although I am all into home cooked food and I love hemp oil and natural remedies, when it comes to certain things, I don't mess around and I listen to what the vet says, my trusted veterinarian team, and I use the tools they give me to get that senior German Shepherd healthy again. So anti-nausea medication, IV fluids may be necessary. If, your senior German Shepherd was really ralphing a lot, had it coming out both ends, he may need to have some IV fluids, or at least subcutaneous between the shoulder blades there. And also an antibiotic may be prescribed if there is some sort of an infection. Now, that's pretty much what they do for acute pancreatitis. If the pancreatitis is severe, all right, let's say for whatever the reason you decided you were going to wait a couple of days to see if it's going to pass, which I really don't recommend, and it's just that much worse, then your fur friend most likely will need to be admitted into the veterinary hospital for 24-hour care. So I hate to say it, but that's the price you pay if you decide to wait. You're looking at a much bigger bill, and your friend has been suffering for an additional 24 hours. So, and I hate to say this, I'm going to get up on my soapbox here. I can't stand that. I'm sorry. If you know they're sick and that something's happening and it's not right, you shouldn't wait days to take them to the vet. You should get them there within 24 hours to get them the care that they need, number one, so that they feel better. And number two, so you don't take a giant hit to your purse because now they need 24-hour care. All right. Down off the soapbox there. I'm sorry. Like I just, that really bothers me. That really bothers me because I obviously have talked with a lot of people. A lot of people have talked with me over the years about dogs and things that they've gone through and Woody's Place and stuff like that. And I've heard quite a few excuses on why they haven't taken their dog for a certain ailment that should have been addressed prior to then. And there's always all these excuses, kind of like why people surrender their dogs. There's always a bunch of excuses. And I just think to myself, you know what? I can do it. And I have 2 jobs. Why can't you do it? There's just no excuse for it. And if you don't have the time or the means to take care of your fur friend, then you shouldn't have your fur friend in the first place because they're living, breathing creatures who feel pain just like we do, pain and discomfort just like we do, only they can't verbalize that they're feeling this pain and discomfort, which is really sad. But to make them wait to get help for their pain and discomfort, in my opinion, is just cruel. So pancreatitis, big deal. Get it addressed right away. Don't wait. And then moving forward, in a few days, you'll start to see that your fur friend is starting to act more like himself again and can hold down regular food again, has normal poops again, and is just generally, back to himself. So it does take a few days to get over, but it needs to be addressed right away in order for you to get to that point with him. And that brings me to the prognosis for senior German Shepherds with pancreatitis. The prognosis depends on the complexity and the severity of the pancreatitis. In mild, less complex cases, the prognosis, it's good. It's good. The most senior German Shepherds make a full recovery. However, even then, there is a potential to develop extensive scarring within the pancreas tissue that, can be a concern later on down the road. But generally, when addressed early and treated effectively with supportive care, your senior German Shepherd goes on to be fine. Unfortunately, the prognosis becomes guarded to gravely ill as the pancreatitis progresses in its complexity and severity. So severe pancreatitis cases can involve other factors, such as the whole body can become inflamed, leading to multiple organ failure, right? That's a big deal. This is why, again, you don't wait. I hate to sound like I'm preaching. Don't wait, don't wait, don't wait. I'll say it till the cows come home. Just don't wait. Go get it addressed right away, all right? Because this can lead to death. It is a big deal. Furthermore, the abdominal cavity can become infected, which is another complication of severe pancreatitis that can also lead to death. And last, but certainly not least, extensive scarring of the pancreas tissue can lead to other conditions such as diabetes and exocrine pancreatic insufficiency, EPI or EPI. And we just covered EPI about 2 episodes ago with Alicia Kennedy, who is the founder of EPI for Dogs. That's epifordogs.com. She talked to us all about exocrine pancreatic insufficiency in dogs and older German Shepherds. She was a plethora of information, folks. I mean, if you haven't listened to that episode, she just really schooled us on everything EPI. And I have to tell you, her website is extremely comprehensive, and I feel like it can be a little overwhelming for some, but they also have this fantastic Facebook support group that if you feel you have, your dog has EPI, you don't know where to turn, or your dog has had pancreatitis, too many times, and now he has EPI. This is the website and Facebook page you want to go to. Veterinarians even turn to her, and that website for up-to-date information. So that says something right there. So yes, all right, that is it. That is pancreatitis in senior German Shepherds in a nutshell. So you can check out the blog post as well to read about it or listen to this podcast again if you feel like you missed something. But we do have all the information right there in the blog post that coincides with this podcast. I think I said that for season 3, they were coinciding. Again, got any questions about Epi, go check out our previous episode. I'll put that link in the show notes and in the blog post. I'll put the link for the episode with Alicia Kennedy about exocrine pancreatic insufficiency in older German Shepherds. All right, folks. Again, after this episode, we have 3 more of the top 20 health issues in senior German Shepherds. So what do we have next? We have panis, perianal fistula, and the last one is thyroid issues. So that's what's coming up in the next 3 episodes. Panis, which is an eye condition, perianal fistula, and thyroid issues. So, all right. Thank you so much for tuning in. Thank you for being a part of this. I really do appreciate it. And I'm so glad to be able to share all of this information with you about the top 20 common health issues in senior German Shepherds, and hoping it is giving you some value. Really, I am. All right. So until next week, be well. And real quick, happy St. Patty's Day.